Hello everyone, and welcome to another episode of Ask Dr. Bob, and this is the last episode for 2013. I'm looking forward to 2014, and I apologize. Last week somebody asked me about autism and a drug called OxyContin. They've done some studies and research on it, and I went and did a little bit extra research on it myself, and basically OxyContin stimulates the reward center in the brain, and it also talked about it helping the whole social interaction of somebody. Personally, I would not use OxyContin or any type of drug to help anybody with any type of condition. What I have found from my experience, probably one of the best ways to help someone with autism and any other challenge that somebody might have with brain function is make sure that you have the right oil. We use a fat that has DHA in it, which is usually a marine oil. That's really important, by the way. Make sure you have enough Celtic sea salt or minerals in the individual's body, and B vitamins, because B vitamins are really important also for long-term optimal wellness of the nervous system. Okay, Dr. Bob, what are the best New Year's resolutions? And I'm going to tell you right now, that is probably the question for the moment. And here's what I would suggest that you do. The best resolution is make sure you take time to rest. I believe so many of us are going 100 miles an hour and never take time to stop. And I look on people on TV and people in my conversation, they have very large pupils. And pupils that are large usually mean adrenal gland exhaustion. Try to be in bed by 10 o'clock because that gives your body enough time for healing and tissue repair at nighttime. So number one resolution, be in bed by 10 o'clock. In regard to all the other resolutions, you know which ones I'm talking about. Lose weight, eat right, etc. You know that. But nobody ever talks about enough sleep. Here's a very interesting question. How do I stop the cracks in my nails? They are painful. And I want you to know, I've had that to myself before. But you want to be very, very consistent with a product that is, we've used Burt's Bee Cream in the past. You could use any kind of oil, and you'll just literally wipe it on your cuticles at nighttime. But probably even better than that is making sure you drink enough water, take oil, and calcium. Calcium citrate or calcium lactate is really integral to help make tissues strong along those cuticles. Oil is really important, and water is important because during the wintertime your skin tends to dehydrate as your whole body dehydrates. So make sure you're drinking a minimum of a quart of water every day. I use reverse osmosis water, which is a purified water. You can actually get a reverse osmosis unit pretty much at any big box store today for around $200. Here's the last question we're going to give you for 2013, and one that I've answered before. I want to stop hair thinning. And once again, I look at people on television and conversation. When I notice that someone, a female, 25 to 30 years old, is having thinning hair, usually it's a symptom or a body signal to me that they have subpar thyroid function. The thyroid function is impaired by chlorine, bromine, and fluorine, which comes from municipal water. So just be aware, you should have a shower dechlorinator. Now, I also can tell you, I personally take 12 milligrams of iodine every day. That helps support thyroid function. I also have noticed a lot of young men have thinning hair or no hair, and I've seen that restored with individuals by making sure they have enough oil. Oil is important for optimal hair follicle and hormonal function. And several years ago I read this article in a book called The Nutritional Almanac, Dr. Robert Goodhart, and they did studies with lab animals that they deprived the oil and they started to have thinning hair. So oil is important, and omega-3 oil, optimal EFAs will help your body. So let's do a little bit of a review. OxyContin, I really wouldn't use it for any type of condition at all. Make sure you put some kind of oil on your fingertips at night, your cuticles, and finally, you want to make sure that you have some oil for your hair and get to bed by 10 o'clock. Happy New Year. Look forward to all the Ask Dr. Bobs in 2014.